Welcome, everyone. Today we're diving into a critical topic that every medical student must master: hypertension. Hypertension, or high blood pressure, isn't just a condition, it's a complex landscape with far reaching implications for patient care. Understanding its nuances, from diagnosis to management and treatment, is essential for providing effective health care. Throughout this comprehensive guide, we'll equip you with the knowledge and strategies needed to navigate this intricate terrain successfully. So let's delve into the complexities of hypertension and empower ourselves to better serve our patients. Now, let's delve into the classification of hypertension: primary versus secondary. Primary hypertension, also known as essential or idiopathic hypertension, takes the spotlight as the most common form, making up approximately 90–95% of all cases. Its roots are often tangled in a web of genetic predispositions, environmental influences, and lifestyle factors. Identifying and managing these contributors is pivotal for effective treatment. On the flip side, we have secondary hypertension, a less frequent occurrence comprising 5 to 10% of cases. This type arises from underlying medical conditions or medications, conditions such as coarctation of the aorta, primary hyperaldosteronism, pheochromocytoma, and renal artery stenosis can all be culprits in secondary hypertension. Recognizing and addressing these root causes is paramount for effective management. Accurately distinguishing between primary and secondary hypertension is crucial as it guides our treatment strategies. While lifestyle modifications and pharmacotherapy may suffice for primary hypertension, targeted interventions to tackle the underlying conditions are often necessary for secondary hypertension. Moving on to the presentation and evaluation of hypertension. Initially, patients may come in for routine wellness exams or as part of mandatory physical evaluations for work or school. It's crucial to take note of any pertinent family history of hypertension and other risk factors such as a sedentary lifestyle or abnormal lipid markers. During the first office visit, the patient's blood pressure is measured, and if elevated, let's say for argument's sake around 158/95, it raises concerns. At this stage, we recommend lifestyle modifications. These include adopting a high-fiber, low-salt diet, starting an exercise program, and considering smoking cessation if applicable. However, if the patient's blood pressure doesn't show significant improvement after 6 to 8 weeks of lifestyle changes, it's time for a follow-up visit. Here, the clinician may proceed to initiate monotherapy with an antihypertensive medication like hydrochlorothiazide to manage the patient's stage 1 hypertension. Let's discuss hypertensive crises and differentiate between urgency and emergency. First, we have hypertensive urgency, identified by a blood pressure reading of 180/110 or higher without any signs of organ damage. In such cases, prompt treatment with oral antihypertensive medications is necessary to gradually lower blood pressure, typically over hours to days. On the other hand, hypertensive emergency is a much more serious scenario. Here, elevated blood pressure is accompanied by signs of end organ damage, such as chest pain, shortness of breath, or neurological symptoms. This constitutes a medical emergency requiring immediate hospitalization and intravenous antihypertensive therapy to rapidly lower blood pressure and prevent further complications. Then, there's malignant hypertension, a severe subtype of hypertensive emergency. It involves accelerated or malignant hypertension along with evidence of end organ damage, such as papilledema, optic disc swelling. Swift and decisive treatment is crucial here to prevent life-threatening complications. Understanding these distinctions is vital as it dictates the urgency and intensity of our response to hypertensive crises, ensuring timely and appropriate intervention. Now, let's delve into considerations regarding antihypertensive medications. Diuretics, such as hydrochlorothiazide, often take the spotlight as the first-line medication. They're favored for their generally well-tolerated nature and effectiveness in managing hypertension. For patients with comorbidities like diabetes or kidney disease, ACE inhibitors like lisinopril or enalapril are preferred. These drugs offer added benefits beyond blood pressure control, making them suitable choices for certain patient populations. In cases of pregnancy, safety is paramount. Medications like labetalol and methylprednisolone are considered safer options for managing hypertension during pregnancy, ensuring the well-being of both mother and baby. Understanding the potential side effects of antihypertensive medications is crucial for effective management and patient education. By being aware of these effects, we can tailor treatment plans to optimize patient outcomes while minimizing adverse reactions. Let's explore the nuances of managing hypertension in diverse populations. Starting with pediatric hypertension, it's essential to recognize that hypertension in children often stems from underlying conditions like coarctation of the aorta or renal artery stenosis. This calls for a focused evaluation and a targeted treatment approach to address the root cause effectively. Moving on to hypertension in the elderly, we encounter unique challenges. Age-related changes, comorbidities, and polypharmacy can complicate hypertension management in older adults. This necessitates a more personalized and cautious treatment strategy tailored to individual needs. In the realm of hypertension in pregnancy, careful monitoring is paramount. Utilizing pregnancy-safe antihypertensive medications like labetalol and methylprednisolone is crucial to safeguard the well-being of both the mother and the developing fetus. Navigating hypertension in diverse populations requires a nuanced understanding of specific risk factors, physiological changes, and treatment considerations. By addressing these factors proactively, we can optimize outcomes and improve the overall quality of care across different demographic groups. Let's explore the intersection of hypertension with various comorbidities and their implications for treatment. Starting with diabetes, individuals with hypertension face an increased risk of cardiovascular complications and kidney disease. To address this, ACE inhibitors or ARBs are preferred for their nephroprotective effects, helping to mitigate these risks. Moving on to chronic kidney disease, the relationship between hypertension and kidney health is bidirectional. Hypertension can accelerate kidney damage, while kidney disease can also contribute to hypertension. Here, ACE inhibitors or ARBs are recommended to slow the progression of kidney disease and manage hypertension effectively. Now, cardiovascular disease comes into focus. Hypertension stands as a major risk factor for heart attacks, strokes, and other cardiovascular events. For patients with a history of cardiovascular disease, beta blockers or calcium channel blockers may offer beneficial effects, aiding in the management of hypertension while addressing cardiovascular concerns. Understanding the interplay between hypertension and comorbidities is crucial for comprehensive patient care. By tailoring treatment approaches to address both hypertension and associated conditions, we can better mitigate risks and improve overall health outcomes for our patients. Let's explore a comprehensive approach to managing hypertension. First and foremost, lifestyle modification takes center stage. Implementing a healthy diet, regular exercise, and smoking cessation are essential first-line interventions. These actions not only significantly improve blood pressure control but also promote overall cardiovascular health, laying a strong foundation for long-term well-being. Moving on to pharmacological therapy, we find a diverse array of antihypertensive medications available. These include diuretics, ACE inhibitors, angiotensin II receptor blockers, ARBs, calcium channel blockers, and beta blockers. The choice of drug is tailored to the individual patient's needs and comorbidities, ensuring personalized and effective treatment. In terms of monitoring and follow-up, regular blood pressure monitoring is key. Adherence to treatment plans and close follow-up with healthcare providers are crucial for effectively managing hypertension and preventing long-term complications. This ongoing oversight ensures that treatment remains optimized and adjusted as needed. Lastly, multidisciplinary care emerges as a vital component. A collaborative approach involving physicians, nurses, pharmacists, and other healthcare professionals provides comprehensive care. By addressing barriers to treatment and empowering patients to take an active role in managing their hypertension, this team-based approach enhances patient outcomes and fosters holistic well-being. Adopting a comprehensive approach to hypertension management ensures that patients receive the multifaceted support they need to achieve optimal blood pressure control and reduce their risk of cardiovascular events.